everyone, welcome to the show. Now, Nazreen Subrati is the ambassador for lupus awareness, and she's talking to me via Skype in Durban. I decided to do the episode to talk about this condition, to make our public aware about some of the symptoms and some of the challenges that people go through when they suffer from this particular disease. Now, I've did some reading last night on some of the symptoms and looked at some of the aspects as to who can get lupus and who cannot, or rather, I don't think that I should say who cannot, but what the incidence rate is, especially amongst females. Nazreen, welcome to the show.
Shukran, pleasure to be here.
Now, the interesting thing is that you contacted the show to talk about lupus as a disease and some of the challenges that lupus sufferers encounter during this journey of suffering with lupus. Now, I think that a lot of people heard the term lupus before, but I think that it's very important that we sort of delineate that and sort of say, what do we define as lupus?
Okay. Well, the first understanding would need to be that you get different types of lupus. And there are many types, but the 5 main types you get is your discoid lupus, which generally affects just your skin. You get the systemic lupus, which is in your immune system, and that is the most common and also the most fatal of the 5. You get neonatal lupus, which affects newborns. Drug-induced, which is temporary because it's brought on by medication that you are using at that point. And then you get childhood lupus, which affects just kids. But my focus is more on the systemic lupus because it's the most common.
Okay, but just taking one step back, we're talking about the disease that's an immune disease, am I correct? Autoimmune disease. So this means that the body's defense systems are slightly confused, if I got this right, and therefore maybe not fighting off the bad guys that's coming into the system, but at the same time affecting the body's, I'm not sure, yeah, exactly, making sure that your defenses are low. Have I got this right?
So far, yes. It's termed as chronic because it's lasting longer than 6 months. And auto meaning self.
Correct, yes. So let's just go one step back before we get into all the scientific aspects of lupus. You as a person, what's that journey like for you? Where did that start for you?
My journey started in 2013. I actually took the flu vaccine, and the doctors believed that was my trigger. Because I've always taken the flu vaccine and I used to be fine, but this was the first time that my body reacted differently. So it was like a 4-month journey to being diagnosed. So it was like hell. I kept getting sick every 2 weeks. I was back and forth to the doctor. I even had sinus surgery done in the process, but I still wasn't getting better. Until the 4 months later, I ended up getting a heart attack. And I was admitted into...
You actually had a heart attack as a result of this. Now, that must have been quite an experience, or rather shock to you, noting that, I mean, you look like you're in the prime of your life, and your heart attack comes along. Did you immediately sort of realize that this heart attack had something to do with the flu vaccine, and had something to do with maybe, I'm not going to use the word predisposed, but an idea that you might have something else? I
didn't think anything at that point. I knew that my lungs were affected because I kept getting pneumonia in that 4 months. And so I thought, okay, it's the lungs. And I went to the hospital and they said, no, we'll admit you for pneumonia. And the ECG didn't pick up the heart attack. It was actually picked up in the bloods. And I didn't even know that was possible. They look at a thing called the troponin T level, which is supposed to be 100 and under. Mine was sitting at 900. And they said, no, we're moving you to the ICU. And I'm like, oh God, why? You know, I freaked out. And they said, no, you're having a heart attack. And I was in hospital for a month. They were testing me for swine flu, bird flu, cancer, hepatitis, everything. And everything was coming back negative. We couldn't find out what was wrong. So the last test they did was the anti-nuclear factor blood test, which is one of the tests they use to test for lupus. Unfortunately, that came back positive. And that's when my journey began of educating and learning about lupus.
So did you at that point just take a back step, sit back for a moment and say to yourself that my life is drastically changing? Or did you just accept that, thinking that, you know what, this is part of life? Because I suppose different people have different mechanisms in terms of how they respond to news that is defining to them.
At first, I didn't know what the doctors kept saying, you have SLE. And to me, it was like, what is SLE? I don't know what this is. So like anybody else, I took to Google to research what it is, and I didn't like what I read. And you could say that I went through the stages of like how you go through grief, anger, frustration, depression. And
why is it all happening to me?
Because I didn't like what I was reading, and I kept looking up and asking God that, you know what, I'm a nice person. Why would you give me something like this? Because it's a lifestyle change, not just an illness. Until I met another lady that told me that she was diagnosed in 1979, and at that point nobody even knew what the word lupus was, let alone how to treat it. And she says to me,
1979. Okay, so that's going on close to 40 years.
And she told me not only with lupus, but with any illness, you need to keep the faith. And secondly, stay positive. And that's half the battle won already. So that's when I changed my mindset and said, you know what, it's there. I can't get rid of it. I accept it, but I'm going to embrace it. And I'm not just going to stay quiet about it. And then I add humor to that there, you know, motivate people, make you laugh, because just for that few seconds, you know, that you forget what you're going through can make a difference. And that's what I've been doing since then. I said, God always gave me a voice to speak. So maybe this is my calling to, you know, raise awareness and help others that are in my situation, but is not as outspoken as me, to be a support structure for them. And that's what I currently do.
Yes, so I think it's one of the typical inspiring stories, and I think that recently you probably noticed that I've been talking about people inspiring other people. I felt that on whichever level it is, that different people need different levels of inspiration based on the circumstances and experiences that they experience at certain points in their lives. And therefore I think that there are probably lots of lupus sufferers watching the show right now that just needed you to say something, and that is, I suppose, that you can make it, and you can get through what you need to get through. And I think that's where we want to maybe shift our focus to somewhere in the show. But for now, let's talk about symptoms specifically. What do people experience? Are these symptoms sometimes accompanied by depressive behavior? Because like you mentioned, what concerned me is that you mentioned that at the time that you note that you have a problem, that could come as a shock, and that shock normally turns into grief, despair, and then from there it can head up into depression, anxiety, and that sort of thing. And with all of that out of the way now, you've maybe passed the stage where you said, I'm going to take all of that and turn that into a positive, but not everybody can do that. So, and that's the reason we have this discussion today. But in the end of the day, what is it that lupus sufferers experience on a day-to-day basis, and how does that challenge their daily lifestyle?
Some of the most common symptoms are you get the skin rash, or it's called a malar rash, that goes across this area, your cheekbones and on the bridge of the nose. It looks like a butterfly rash. That's how they refer to it. So that's one of the symptoms. You have extreme fatigue, and it's not like the fatigue that you experience if you lose a night's sleep or you've been out partying all night. It feels like somebody literally plugs a vacuum onto you and sucks out all the energy. You have unexplained fevers that come about without any infection. So you could be fine right now, and an hour later you'd have a fever and you'd just be laid up. You have arthralgia, which is your stiffness, pain, and inflammation of the joints, which is different to arthritis, which is your swollen joints. So you can
So does these symptoms just come at any time? Do they just rock up, or does it doesn't mean that you need to sort of knock your arm or your leg somewhere to get a swelling or anything like that? It just means it will just decide to come.
Yes. And you can't generally know when you're going to get a trigger or a flare. So it can happen at any time. You're like a walking time bomb, basically.
Yes, correct. I note some other symptoms. Are these symptomatic of all types of lupus, or are they just specific? People are talking about chest pains, hair loss, sensitivity to the sun, some mouth ulcers, and then the other ones which you have started alluding to is obviously headaches, dizzy spells, feeling sad, which I thought is going to come with all of this, confusion and seizures. So different patients have different manifestations.
No two people will experience the same symptoms. That's why it's difficult for doctors to diagnose it, because they don't know what causes it, so they can't cure it. And if you may experience one thing and I'll experience something else, so it's hard for them to see how to treat it as well. So everything becomes trial and error as well.
So your daily life, let's go to a day in your life. So you're saying that one day I would just get up, or rather I'd go to bed and everything would be fine, and then the next morning I'd get up and I might end up with one of these particular symptoms. Okay. And I think for most people, for most people what has happened here is that they would assume that any of these, they would have either flu or cold or something is going on, and they'd feel miserable for the day.
That's it. And you'd end up going to the GP, and he'd give you an antibiotic and your general flu meds. But you'd notice that by the time the course is done, you're still not getting better.
So what happens now when you go to a doctor? So what would happen is, if I have a chest cold and my nose is running and my ears are blocked and that sort of thing, I will go to the doctor, but I would know that I do have a flu in the making, or a cold, for example. Now, the aspect of differential diagnosis is an issue that comes to my mind here, in terms of, so you go to the doctor. Does he look at your card and say you're a lupus sufferer, and I cannot determine whether you got a flu at this time, or these might be symptomatic of the lupus raising up to some point? How is your diagnosis made for simple things like flus and colds, for example?
You have to end up going to the GP first, and we do the course of antibiotics, and if within that 5 to 7 days it doesn't come right, then you go back, and that's when they get blood tests involved and stuff. It's very difficult for doctors as well to determine if it's really just the flu or if it's lupus. I mean, at one point I had gallstones, and the doctor says to me that when I got back to the rooms, he says, "I'm very happy to say you've got gallstones." I'm like, okay, should I be happy for that? He says, no, because if it was lupus related, it would be a problem. So it's like that with the doctors as well, with the flu. It's very difficult. They have to treat you as the flu first, and then come over to this side with bloods, and well, obviously then you get hospitalized, where they put you on steroids via an IV, and you just need to rest it out.
That's it. I think that's fairly challenging for any general practitioner out there, or any specialist. So yes, correct. Let's talk about the chronicity of the disease. You become chronic by the minute you notice you've got lupus. Are you saying that you're chronic? Is it never going to go away?
No, it can go into remission.
It cannot be repaired.
No.
Yes, I know about the remission aspect, but it will never totally disappear.
No, unfortunately, not yet. There are lots of organizations around the world that are actually working on finding something to put it in remission for longer, with lesser flares. Because I mean, you're dealing with your lupus symptoms, and you're dealing with the side effects of the medications that you use. So they're trying to lessen the medications that you use also. So there's a lot of research currently underway, but not so big, unfortunately, in South Africa.
So listen, so Nazreen, you're invited to a wedding on Sunday, right? Or you're involved with a family wedding, for example. Chances are that you could get something that will just make that day a bit more difficult to go to. Am I correct? So do you think about all these things as a patient, like not committing to certain things, or do you just go out there saying, I'm going to do it no matter what?
Sometimes I try and avoid the crowds, because with our immune system being compromised, we pick up infections quicker. But I do wear a face mask when I go out in public. We went for a function last week. It was a funeral, and I did wear the mask. But you know, with people now, when they see you with the mask, they think that you are contagious. And lupus is not contagious. It's actually, I'm protecting myself from you. So, but I refuse to just sit back. I mean, even like I go to the mall, I put the mask on, and it was the most difficult thing, because you have to be very strong in your mind to do that, because, you know, people stereotype you and are watching you, but I wear it.
Yes. Correct, yes. Yeah, now I can only imagine, because I remember some months ago I was in Saudi Arabia, and you know, you see some of the nations wearing the mask, and you think to yourself, do you guys think we have a problem? Or is it that you have a problem that we don't know about? So you're 100% right about that. So, okay, so that's some of the challenges that you can experience in your daily life. You're talking about awareness. What's your awareness driven to? Is it to inform the public how to deal with people that have lupus? Are you maybe saying that some people go undiagnosed for a long time? Is that part of the awareness?
Yes. You see, if you diagnose it early and you know the symptoms early, you can treat it earlier and save your organs. I mean, if it goes untreated and the lupus keeps flaring, you can end up in multiple organ failure. And that's what we don't want.
No, that's concerning, because you're saying that it can affect your organs, and I think that people, their minds just sort of open up when you say something's going to affect an organ. People are happy to have a rash and happy to have a bump and a sore arm, but when you say organs, you know, people's ears just go open. So that's an issue. So if you're saying that if you're going to go undiagnosed, there's a possibility that you can start damaging your organs.
I mean, like my lupus, in that 4 months, I had it affect my heart, where I had myopericarditis, which is your inflammation of your heart and fluid buildup around the heart. It affected my lungs, where I often get pleurisy and pneumonia. And currently I have interstitial lung fibrosis, which is the scarring of the lung tissue. The lungs basically is dying, and they cannot stop the progression but slow it down. And if I tell you, currently I'm undergoing chemotherapy. And I've been since August, and it'll be till January. And people say to me, but you don't look like you're going for chemo. So it comes down again to mindset.
Some of the reading I did last night was on the relation between chemotherapy and lupus, and the confusion and the stigma attached to chemotherapy is the fact that you might have cancer. Now, chemotherapy can be used for lupus also, but I think there's a confusion. The minute you tell people you're on chemotherapy, they think that you have cancer. Yes, and you're probably experiencing a lot of that.
People look at you confused and like, then you got to say to them, no, I don't have cancer. It's actually being used for lupus. But that's what happens with lupus medication. It is no one set medication. You're using a lot of different medications to treat the lupus, to suppress it basically, to suppress your immune system. I mean, lupus sufferers, yes, can get cancer as well. So it's not unheard of, because I mean, the odd part is that lupus makes your immune system overactive, whereas cancer makes it underactive. So it becomes a war again in your immune system.
Correct, yes. So I'm going to ask you a very brutal question, and I don't know if you're ready for that, but let's, for the purpose of our viewers. The question is that any disease, when you start looking at complications in particular diseases, you start looking and studying any symptoms and that sort of thing, one of the first things that patients tend to do is to look at how does this affect my lifespan. Yes. And people ask questions about, if I have this disease, can I make it to 70? Can I make it to 80? Does it cut down years of my life, for example? Has these thoughts crossed your mind? And is there anything related to this where people saying that lupus sufferers don't make it to this age and that age and the other? Now, I'm not trying to be negative about this. I'm just trying to face the fact, because I'm 100% sure that these questions are in the minds of people that are watching the show right now.
Yes. It all comes down to mindset again. I mean, like from what we researched, if you get lupus as a child, they say your time span is added to 2 to 3 years. If you're a teenager, 3 to 5. And when you're older, because your organs are more developed, you have a little longer lifespan. But at the end of the day, it's up to the individual. If you say, listen, I've got this illness, I'm not just going to sit back and just accept it. Your mindset changes, because it's not about, I want to just survive, I want to live. So you live for the day and you try and go as far as you can. I mean, I know a lot of people that have lupus for 20 years and over, and they're still doing fine, and they're still surviving, and they're still living. So it comes to you. I mean, I did have those thoughts where, am I going to see 40? Am I going to see 50? I want to see my son grow. So I take it as the day comes. If I wake up the next day, I'm happy to be there. I'm thankful for that. If I see the evening, I'm thankful for that, and I carry on. But I don't like to procrastinate and put off something. If you can't do it today, you do it.
Correct, yes. But in the end of the day, I think you're 100% right. I think that the way that people approach their problems from a psychological point of view plays a major role in how they manage themselves. So if they are going to have a negative mindset and be very non-prospective about what is going to go on in their lives, and have no outlook and positivity in that space, then that's going to affect them from a negative point of view. We do understand that stress and environmental factors do play a role on one's psychological status at any point, meaning that if those environments are not in order and not in balance, and then you can take a dip and a dive in whatever situation you are experiencing at the moment. And we've seen that happen to cancer patients and all kinds of patients. So I think lupus is probably the same. I think that the fact that you propagating a positive attitude, I think that plays a crucial role in telling people how to manage themselves. Talking about the management of the disease, it's about the management. People have diabetes, but they don't manage the disease. So they do all kinds of things, and then they expect to have results through medication. Now, I'm not a GP, but I don't think that actually makes sense. And I think that the same thing would happen in your case. And I think that's it's a combination of medical science, but the ultimate call is you as an individual. Are you taking the advice? So what do you suggest lupus sufferers to do on a daily basis to make their lives easier and to make sure that they have better coping mechanisms and skills to deal with lupus?
Firstly, it's very important for you to have a good relationship with your GP and your rheumatologist. A rheumatologist is generally the specialist that diagnoses and treats and helps you manage the lupus. So when you feel something coming on, you can either phone or email your rheumatologist to say, listen, this is what's happening. And they will tell you at that point, okay, you need to do this or that, and that's the first step. Secondly, you want to take as minimal of medication as possible. And the only way you can do that is by listening to what your specialist tells you. If they tell you to eat a certain way, if they tell you to exercise, I mean, I know it gets difficult for lupus sufferers when they have the joints affected, but you got to be at a point where, you know what, there is exercises that you can do, so it doesn't make it difficult for you. So you do that, so you don't want your joints to seize. But you don't just sit back and say, it's there and that's it. Go forward. Eat the right way, exercise, smile, laugh, because you're inspiring other people. You know, so, and you want to take lesser meds. I'm currently taking only one prednisone. I've been for the past 3 years, because you know with steroids, it makes you put on weight. And I've currently lost 15 kgs because that I tell my doctor that I refuse to want to go in a section of the store and shop where it's only large clothing. And in 2 weeks, I did 4 kgs. And she was like, God, how did you do that? I said, it's in your mind. If you believe you can, you can.
Correct, yes. And I love those words, Nazreen. If you believe you can, you can. And I think that goes for anything in life. We've reached the end of the show. I want to thank you for coming on and being an inspiring guest. I think that people in different walks of life and different scenarios in life, when they come out and they rise above a situation and they tell people in that are sitting in similar situations that you can come out of this and you can do it. And they look at you as a beacon of hope. And I think that's important. So we want to thank you for what you do for society at the same time. And thank you for coming onto the show. Thank you. Nazreen Subrati, and she's the ambassador for lupus awareness, telling us about her journey, some of the symptoms and some of the treatments and some of the attitude. And the attitude is important. I think that whatever you believe you can be, and that's an important life code. Thank you for joining us. Goodbye.